Hospitals are facing a serious struggle against time and low revenues. They're trying to stay open, but simply cannot.
News Channel 5's Kyle Horan is taking an in-depth look at the issue and possible solutions.
Those at the state capitol say it is noble to try to help out rural hospitals right now, although there are some that are questioning if people are doing enough.
That's the front entrance right there.
David Livingston, the mayor of Haywood County, is very excited about this old building that's about to be turned new.
These tiles represent all the children that were born in this hospital and were treated here. And Braden Health, who will be the new provider of health care here, has decided to keep these tiles because obviously they're historic.
Come November of this year, this will be the renovated and reopened Haywood County Community Hospital. Years ago, the hospital closed down. It's located in Brownsville. Mayor of the city, Bill Rawls, remembers when it stopped operations.
You don't miss the water till the well goes dry. But when the well went dry on acute health care for Haywood County, people were concerned, people were afraid, people were confused, and people were bewildered. Now there's an opportunity to come back up. The entire community is very, very excited and very aware of what's going on here.
The next closest hospital is in Jackson, 35 miles away. But that hospital can't handle everything, in which case it's much farther to Memphis. Haywood's hospital is able to reopen because they were purchased by an outside company, Braden Health. They had to obtain what's called a certificate of need to do so, a process that can sometimes take years. The state wants to make it easier for other hospitals to follow suit.
We have a process in the state where government tries to tell healthcare where they can expand and where they can go. And so we've been working for this for over a decade to reduce those government barriers. And so that's the bill that we have, is we're trying to loosen up the government restrictions.
It allows hospitals to reopen without obtaining a CON. But some say the real way to help hospitals is just expand Medicaid.
But it's difficult to see how any of that's going to work if we're not making sure they get enough revenue. And right now, Tennessee is turning down $1 billion a year in revenue that would go into hospitals, including those rural hospitals.
Kyle Horan, News Channel 5.
Thank you, Kyle.